How does fluphenazine compare to other antipsychotics? If you are curious about how fluphenazine stacks up against other antipsychotic medications, you are in the right place. Let's break down the details to give you a clearer picture. Fluphenazine, known by the brand name prolactin, is a first-generation antipsychotic primarily used to treat chronic schizophrenia. It belongs to the phenothiazine class and works by blocking dopamine receptors in the brain. This action helps reduce positive symptoms of schizophrenia, such as hallucinations and delusions. When comparing fluphenazine to other first-generation antipsychotics, one key factor is its potency. Fluphenazine is considered a high-potency antipsychotic. This means it can effectively manage symptoms at lower doses compared to low-potency drugs like chlorpromazine. Despite this, fluphenazine is generally just as effective as low-potency medications in treating schizophrenia symptoms. Another important aspect is how fluphenazine can be administered. It can be taken orally or given as an injection. There is also a long-acting depot injection that lasts up to 4 weeks. This is particularly helpful for patients who struggle to take their medication daily. However, like other first-generation antipsychotics, fluphenazine can cause side effects. These may include movement disorders, sedation, and weight gain. It can also increase prolactin levels, which may lead to hormonal imbalances. Now, how does fluphenazine compare to second-generation antipsychotics? Generally, second-generation antipsychotics, such as risperidone and olanzapine, tend to be more effective in treating negative symptoms of schizophrenia. Negative symptoms include things like apathy and social withdrawal, which first-generation drugs like fluphenazine may not address as effectively. In terms of side effects, second-generation antipsychotics often have a better profile. They usually cause fewer movement disorders and have a lower risk of tardive dyskinesia. However, they may come with other side effects, such as weight gain and an increased risk of diabetes. In clinical practice, second-generation antipsychotics are more commonly prescribed today. Yet, fluphenazine remains a valuable option for certain patients. It can be particularly useful for those who respond well to it or have specific needs that newer medications do not meet. In summary, while fluphenazine is a solid choice for managing chronic symptoms of schizophrenia, especially for long-term therapy, it is generally less favored compared to newer antipsychotics. Its side effect profile and limited effectiveness on negative symptoms are important considerations for both patients and healthcare providers.